How to improve swelling while you sleep. When lymphatic fluid gets backed up or congested, this causes the body area to swell, which is the primary sign of lymphedema. The goal of treatment is universal, to reduce swelling and to keep the lymphatic fluid continually moving throughout the body through daily activities like movement and therapeutic exercises. But how do we maintain this necessary lymphatic flow when the body's at rest? How do we treat the critical period of swelling when you're asleep? In this video, I'll explain the two distinct phases of lymphedema treatment and the crucial, detailed strategies used to manage swelling while you sleep. Don't miss the final topic, which covers innovative technology designed to actively mobilize fluid and soften tissue while you're completely at rest. Welcome back. I'm Dr. John Chuback, a cardiovascular surgeon, and today we're talking about lymphedema management, specifically focusing on how to improve swelling while you sleep. Lymphedema management is universally divided into two comprehensive phases. The first is the reduction phase, often lasting an average of 3 to 5 weeks of intensive daily treatment. The objective is absolutely critical to decrease the volume of edema in the affected limb or limbs as much as possible, and to physically soften any thickened, hardened tissue that's developed, a condition known as fibrosis. This phase involves the most demanding part of complete decongestive therapy, or CDT, which aims to achieve the maximum possible volume loss and create a new, smaller baseline volume for the limb. If the reduction phase is insufficient or skipped entirely, the limb volume remains chronically high, which makes lifelong maintenance nearly impossible and dramatically increases the risk of recurrent infections, what we call cellulitis, and irreversible tissue change. The proper initiation of CDT, complete decongestive therapy, typically administered by a certified lymphedema therapist, a CLT, is vital here to achieve the maximum possible volume reduction. Studies show that successful long-term outcomes are intrinsically tied to the commitment of the patient and the therapist during this critical short-term intensive phase. Once the limb volume has been reduced and the tissue is softened, patients transition into the maintenance phase. This is what we call phase 2. The goal here is simple, but demands perpetual vigilance to avoid the edema volume from accumulating again by keeping that lymphatic fluid moving consistently through the limb and preventing stagnation. Maintaining the reduced volume requires daily, uninterrupted consistency. Fluid accumulation can recur rapidly, sometimes within 24 hours. If compression is discontinued, this is even more likely. If the lymphatic fluid is allowed to stagnate, the body's natural healing response is to lay down more collagen, causing the soft tissue to reorganize and thicken, leading to more severe and often painful and much harder to treat fibrosis. This phase relies on the long-term, daily, and correct use of custom or specialized ready-to-wear compression garments, combined with meticulous skincare and regular therapeutic exercise. Research strongly demonstrates that patient adherence to compression garments, meaning consistent wear for more than 12 hours a day, is the single most important factor in preventing volume increase over time. At night, the powerful muscle pump is inactive, manual lymphatic drainage stops, and therapeutic exercises cease. Therefore, when the body is completely at rest, the management of lymphedema shifts almost entirely to the use of compression. This is a period where the limb is highly vulnerable to fluid rebound due to the combined effects of gravity and complete lack of muscle action. Interstitial fluid tends to pool back into the limb easily during sleep, negating the work done during the day. This necessitates specialized nighttime compression that's both comfortable and effective, working to move any fluid accumulation that occurred during the day and preventing large destabilizing fluctuations overnight. Nighttime compression products must be designed with materials that are safe on the skin, allow for flexibility, and most importantly, must not cause a tourniquet effect at any point on the limb. The International Society of Lymphology strongly emphasizes that continued compression is essential for maintaining the volume losses achieved in the intensive phase. For those actively engaged in the initial reduction phase, phase 1, or who present with advanced chronic or highly fibrotic lymphedema, the use of short stretch compression bandaging applied in multiple layers remains the proven gold standard for reducing edema volume overnight. This technique uses materials that create a low resting pressure, making it tolerable during rest, but a very high working pressure, which is activated by even slight body movement during sleep. Crucially, specialized foam and soft paddings are applied under the bandages. These sub-bandage layers create localized tissue indentations and surface irregularities that mechanically mobilize the trapped edema and help break down that thick fibrotic tissue during the rest period. While this process is intricate and time-consuming, bandaging remains the most effective, powerful tool for rapidly achieving clinical volume reduction, with large-scale reviews documenting average reductions of over 60% in affected limbs following intensive therapy. It's often the only method strong enough for the initial phase. For those in the maintenance phase, phase 2, with mild to moderate lymphedema, a fantastic option is transitioning from the labor-intensive bandaging to a specialized, ready-to-wear nighttime garment. A highly effective modern technology option is the use of Mobiderm autofit garments, which actively mobilize fluid. These advanced garments utilize internal foam technology, specifically tiny foam blocks or chips encased between two fabric layers. The gentle compression of the garment presses the small blocks against the skin, creating a precise pressure differential in the minute spaces between the blocks. This pressure gradient acts as a perpetual soft micromassage, encouraging the lymphatic fluid to move and drain out of the congested area. This sustained action also works simultaneously to soften developing or existing fibrosis while you sleep. Compliance with compression is the greatest predictor of long-term success. Choosing comfortable, semi-open, and adjustable garments like the AutoFit line significantly increases the likelihood of long-term patient adherence and maintenance success by addressing the discomfort and high labor demands associated with traditional methods. When it comes to the lymphatic system, movement and subsequent muscle activation are the body's natural pump for lymphatic fluid. However, at night we aren't using those muscles, and the lymphatic system loses that vital support, making the limb susceptible to fluid pooling. Whether someone is in phase 1 or phase 2 of lymphedema treatment, by focusing their nighttime treatment on compression that's comfortable, encourages fluid flow, and actively softens tissues, lymphedema can be well managed for the long term, protecting the limb and the patient's quality of life. I'm Dr. John Chuback, and I will see you in the next video.